I am so lucky because I have a team of physicians and SLPs that I work with, and really the work cannot be done without this collaborative effort. So I often get referrals from ENTs because they see enlarged tonsils and adenoids. They've just removed them, but they know that the child needs more. They need expansion or arch development. So they refer to me. I have a lot of SLPs who are myofunctional therapists, and they see children that either have speech issues or feeding issues, and they know their palate needs developing, and they know they need orthodontics or orthotropics, so they're referring to me. I have sleep physicians referring to me. I also refer out to them if I see enlarged tonsils while I'm doing an examination. If I see speech issues, if I see myofunctional issues or tongue ties, then I'm referring also to either a sleep physician or the ENT or the myofunctional therapist. So we all work really well together, and it's really a collaborative team effort that helps the child on the road to recovery. Over the years, I have lectured to groups of speech pathologists, myofunctional therapists, sometimes ENT, other sleep physicians are in the audience, and so they learn that orthodontics or orthotropics is a big part of their treatment as well. And so we've all been working together, and we teach each other and we learn from each other. So it's really a great team effort. So interestingly, I have a lot of patients that come to me who are kind of getting consults from several different dentists or orthodontists, and they're confused and they don't know what treatment's best, who they should choose to treat their children. And I always just, for one, I want to make them comfortable. I want the child to be comfortable with me, not feel nervous or scared in the chair. That's of utmost importance. But the other thing is, they come sometimes asking for a particular appliance. And I say it's not the appliance. You have to look at each child individually and see what's going on in their mouths, see what they need, what's going to help them. And I actually use several different appliances depending on what the child needs. It is not one magical appliance. Actually, there are many that work pretty well, and you have to choose which one is right for that particular child. I feel very frustrated when I see children with poor health and their parents don't want to do anything about it. And it's not that they don't want to help their children, they just think the natural way is better, that doing nothing is better because it's natural, right? They don't want to intervene. But unfortunately, intervening is sometimes necessary, and in the long run, that's what's healthier, not just letting nature take its course. It is very important to start early because we want to prevent improper growth. We want to prevent health problems. Once they develop, it is so much harder to reverse it, if not impossible. Compliance is a big issue with orthotropics or even arch development because the kids have to wear it. And most of the time I'm using a removable appliance. I prefer them. I think they do a better job. I think they make nicer arches. They expand better. That's my personal choice. And so I need the parents on board. Of course, I need the patient, the child on board. And we work together as a team, and we do it. I spend a lot of time educating patients. That is the most important factor in treatment outcome and success. So that's what I do. My consults are very long. We talk about every aspect of the treatment, what it's going to entail, the outcome, and how we can best achieve success. When people understand why they need to do things and how it's going to help them, outcomes are always better.